We can speak live now to the Health Minister, Maria Caulfield, who's on the programme for us today. Thank you so much for being with us. I just want to start on that tragedy. 4 people dying. I mean, it's literally freezing out there in the dark. I mean, how desperate would you have to be to get on that boat?
Well, I think people are desperate, but also they're under criminal gangs who are making thousands of pounds per journey. And I think, as the Home Secretary said in the House of Commons today, that's just a sheer example of why we need to end this practice. There are legal routes into this country which people can follow. We know that a lot of those people who are travelling in the small boats are economic migrants rather than seeking asylum.
Are there legal routes? Because I know that there are safe and legal routes if you're from Hong Kong or if you're from Afghanistan or if you're from Ukraine. But is it true to say there are legal routes into the UK to claim asylum for others?
From our humanitarian perspective, since 2015, we've taken over 400,000 people. And you're right, for people from Ukraine, people from Afghanistan, from Syria, from Hong Kong. And the Prime Minister said when he made his announcement at the dispatch box yesterday that he's willing to look at further, safer legal routes in for people who are claiming asylum. But we have to deal with what's happening now in the Channel. And we know that a significant percentage of those are economic migrants who are illegally entering the country under the rule of these people traffickers. And this is a classic example of why we absolutely must end this. And as the Prime Minister said, enough is enough.
But you appreciate, though, that, of course, I don't think anyone will dispute that there are economic migrants as well, but there are also people who have faced persecution, and there are no safe and legal routes for many of the people on the boat into the UK to claim asylum.
Well, I think we have been, extremely generous as a country, and I think that, whether it's people opening up their homes to Ukrainian families this year, or whether it's taking in, people from Afghanistan and Hong Kong, we have shown that when people are facing persecution or terror, that we absolutely will take people in. But some of the people that are coming through on the small boats who are claiming asylum, they're coming through many safe countries first before they come here.
Yeah, because there are no, that's the point though, isn't it? Because there are no other ways of them to claim asylum.
But there is no reason
they
why
have to be in the UK in order to put that claim.
But there is no reason why they have to come to the UK to claim asylum. If you're travelling through Germany and France to get here, there's no reason why you have to claim asylum in the UK. And the Prime Minister has been clear, he will look at safe and legal routes, but we cannot continue with this, the numbers of people crossing in those small boats. We know it's putting pressure on our health service, on our schools, on housing. And part of his 5-point plan is reducing the cost of, we're currently spending millions of pounds a day on hotels and putting people up. But, it's not fair on people who come here legally that there are ways into this country that, are bypassing all the rules.
I was having a look when I was researching, this interview about the percentage of asylum cases that have been decided within 6 months, and I was pretty shocked, actually. It's plummeted from over 80% in 2014, decided within 6 months, to less than 10% in 2022. The turnover of asylum caseworkers in 2021 to 22 was 40%. I mean, what on earth is going on? This looks like a system that's completely broken.
Well, I think the Prime Minister and the Home Secretary have acknowledged the failings in the system. I think the Prime Minister was very honest about that and has set up, the 5-point plan where he wants to get through the backlog of claims by the end of next year, that he's putting extra resources into dealing with those claims, and that also that tougher enforcement, that, if people come here illegally, they won't be able to stay and return and claim to stay. So the backlog is one of the key areas of his plan that we absolutely need to get through, because it isn't fair on those people who come here either to be waiting, sometimes years before a decision is made. If people have come here illegally, we need to assess their claim, and then there will be strict enforcement in terms if they've got a legal claim, that will be upheld. If not, then people can't just stay here.
But you acknowledge that under Conservative governments, the situation is nowhere near where it should be.
Well, I think we've had 2 years of COVID, so let's not pretend that we haven't had problems in the last few years.
We're talking about back from 2014.
Yeah, so the Prime Minister has acknowledged that it's one of his key priorities to clear the backlog by the end of next year, because that is one of the problems, that we've not been able to process the claims as quickly as we'd like. He said that from the dispatch box, that he doesn't want to see this in months and years. He wants to see this in days and weeks.
OK. Now I want to talk to you about the nurses' strikes. You were a nurse specialising in cancer treatment at the Royal Marsden, so you understand more than most people what it's like on the front line of our hospitals. I'm sure many of your former colleagues probably, going out on strike from tomorrow. Are they wrong too?
I personally don't support strike action. I don't think their concerns are wrong, and I think I worked as a nurse during the COVID pandemic, and I've worked shifts since as well. So, and dealing with the backlog caused by COVID is, exceptionally hard work.
So what are their concerns then?
So pay obviously is one of those, but I think it's much more than pay. I think it's about the long hours that nurses work, often not finishing on time. They don't get protected learning and development time like doctors do, for example. And skill mix, for example, on the wards. It's not just about numbers on the wards, it's the level of experience and skills that are available too. So when I've met with Pat Cullen, for example, they're the sorts of issues and the Secretary of State wants to talk about in terms of improving the working conditions of nurses. And pay is just a tiny element. And I think the strike action is more about, from talking to my colleagues, is more about their frustration about working conditions rather than pay itself.
So even though you say you don't personally agree with strike action, you've got sympathy for what some of the nurses
I think nurses have had a very difficult time. I don't think anyone's denying that. I just don't see what striking achieves. I'm very much keen to work with Pat and the RCN to look at those conditions, as is the Secretary of State when he met with her this week. But we cannot meet the demands of a 19% pay rise.
Just talking about Pat Cullen and about the meeting with Steve Barclay, because she was pretty disparaging about what came out of that meeting. She said that Steve Barclay showed belligerence, he refused to discuss pay, he was nothing short of disrespectful. I also thought it was interesting to say that she thought the government was displaying macho behaviour towards the RCM because it sees nursing as female work that it doesn't value properly. I mean, it doesn't sound like, she really believes the Health Secretary's got her back.
Well, I'm sorry Pat feels like that. I know Pat very well, and she's a very good leader of the RCN, and I've got nothing but respect for Pat. But we have to be honest that we cannot afford the 19% pay rise demand that they're wanting. That will cost us £10 billion. And as the Prime Minister said at the dispatch box today,
it will cost 10 because there has been some question marks about that figure, hasn't it? It's important to say. The IFS say the government's saying it's £1,000 a household. The IFS says more like £640
well,
a household.
The £1,000 per household is if it was inflation for all the public sector, because we know what would happen if the nurses get an above inflation pay rise. Of course, the ambulance workers will want it. Of course, the teachers will want it. So this is about if we've got an independent pay review body in place that looks at factors such as inflation, skill shortages, recruitment and retention. They come up with a pay recommendation which the government has accepted in full.
So you obviously think that 90% is unaffordable. Nurses are generally being offered around 4%. NHS Scotland is offering 7.5%, still below inflation, but more generous than the current offer on the table for those in NHS England and Wales. What would be a fair pay rise for nurses?
Well, we feel that the independent pay review body to take the politics out of
4%.
And that decision was made. Some nurses are getting more than that. So those on the lower agenda for change pay, some of them are getting close to 9%, but the average is 4%.
It's a recommendation, isn't it, though? I mean, you could overrule it if you wanted. And 4% at a time when inflation figures out this morning are 10.7%. I mean, people are struggling to put food on the table here, aren't they? You can see there's been stories about nurses being forced to use food banks.
Yeah. We could overrule it, but in order to pay for that, we can only pay for that in three ways. The first is to borrow money, and we saw just a few weeks ago when the government borrows money it can't afford, what happens to interest rates and to the market. We could tax people more because it's not the government's money, it's taxpayers' money at the end of the day. We could raise taxes to pay for that. I don't think anyone wants us to do that. Or take it within existing budgets. And that's quite a lot of money at a time when we're trying to clear those COVID backlogs. It would mean taking it away from the surgical hubs we're developing, community diagnostic centres, we're recruiting, say, for example, in mental health, 27,000 extra staff. That's where that money will have to come from. And as a minister, as a government, we have to make those tough choices. And if we've set up an independent pay review body, then we feel we need to honour that. We're taking those factors into consideration, and we have fully implemented that pay review body's recommendations.
I just want to have a look at the comparison between the private sector, what's happening in the private sector, and what's happening in the public sector, because the ONS says that pay growth in the private sector is 6.6% versus 2.2% in the public sector. And you can see there private sector pay going up more generously than public sector pay. Government ministers often say that, we're having to stomach this pain in order to try and beat inflation. But if you're a worker in the public sector, you might be feeling it's a bit unfair. Why should you be the one who's having to bear the brunt of the pain? And you look at the more generous rise that's been given in the private sector.
So there are other benefits to being a public sector worker other than pay. Your job security is much more
That's not
stable.
going to help you pay your energy bill, though.
Well,
right
it
now,
does.
is it?
If you're in the public sector, if you're working in retail or commerce, and in the hospitality sector, for example, where they're reducing people's hours because people aren't going out to eat and drink as they would normally. With the train strikes, people aren't going shopping like they would do normally. There's a lot more job insecurity if you're in the private sector. You also don't necessarily get the same sick pay, maternity leave benefits that you do, or pension benefits that you do in the public sector. So, and as I said earlier, pay is only one small part of most nurses' concerns about working life at the moment. When you talk to many of them who are thinking of reducing hours or leaving, actually pay is probably one of the last things that they actually mention. It's the long hours, it's the hard work, it's the skill mix on the wards. We can do something, and we are doing something about that, and pay is just one small consideration in that.
OK, thanks very much for being on the programme. Good to talk to you about two very serious subjects today.